Well, Molding of Generation Divas came about through my everyday interactions with my clients who are women. And one of the things that I've been finding about as I speak to the women and trying to get them encouraged and inspired is that they have teen girls, and that as moms, especially as single moms, there are certain things that they're facing and they just do not know how to deal with some of the issues that their teen girls are facing. And I myself am a single mother and also a mother of a young lady, and so I know exactly what they're saying. And so with my own experience with my daughter, I said, you know what, we need to get mothers and daughters together. We need to tackle some of these problems and these issues. And I thought that I would, do it the same way that I deal with them in my house, in my household. So that's how Molding of Generation Divas came about, just to bring mothers and daughters, their teenage girls together.
I'm a single parent of two teenage daughters, 13 and 14, Shantae and Naisha. And this was, to me, something good for me and my girls as a single parent, to go and do things together and learn about teenage issues, because when I was a young child, I don't think my mom talked to me about these issues. And I'm trying to do better as a parent to talk to my teenage daughters and to help them work out through some of these issues if I can, and get advice from other parents or other professors or professionals. So that's why I wanted to be a part of it, and I really enjoy doing it with me and my girls.
The topics I covered are topics that we as moms deal with every day in our households, and topics such as social media. We're talking about Facebook, we're talking about MySpace, we're talking about sexting, texting, bullying, cyberbullying. We're talking about sexual transmitted diseases, prevention of sexually transmitted diseases. We talk about abstinence. We talk about drug abuse, health and nutrition, obesity. We have had Dr. Hatim Omar, Medicine Chief at UK Healthcare Division of Adolescent Medicine, to come in with his team of doctors and nurses to educate and to interact and to give moms information on these issues. But not only that, but he has opened his clinic for our parents to take advantage of his services. We've also had Dr. Michael Reeser, who is an adolescent psychiatrist, to come in and give of his time. We've had Central Baptist Hospital nutrition and diabetes program to come and tell us about healthy nutrition and how to fix affordable meals, affordable and nutritious meals for our families. We have had, like I said, educators from Fayette County Public School and Bluegrass Community and Technical College. We even had an educator all the way from Belize to come and speak to parents about being role models for their children. So we're just blessed and very, very grateful for these experts.
There's one teacher, and he basically talked to us about sexually transmitted diseases. And that really stuck with me. That really stuck with me. I mean, I knew about sexually transmitted diseases before, but now I know about them more. And now I know how bad they can get, and that they can harm you, and that they can affect you somehow. And that they won't. And that if you want to have a good future, you really should not. You really should just stick to school and not really worry about that.
We are more closer. We are, I think, more open into talk about things, like, for example, talk about sex, because it was one of the things, the themes that they were talking about in the program, and we are always closer. So they definitely give us, bring us closer.
I've felt more trustworthy to my mom, because I knew that when she signed up for the program, she was doing the right thing by teaching me about these things earlier. And I now feel more trustworthy to talk to my mom about my problems. And I now I now like her more.
I think it has strengthened my relationship with my kids because I'm learning to try to listen instead of just, not listening, and being able to talk a little bit more to them instead of, just accusing or, anything like that. But I really think, really closer, that, different situations, not all of them, that they feel like they can talk to me about different things that's going on in their life. The last program, we had 3 sessions. So from the last session, we had a back to school supply or back to school rally, and it blessed us as parents and kids with school supplies, backpacks, ink pens, binders, what our kids needed to start off school for free of charge. Didn't have to pay for any of it.
I found out about the Partners for Youth grant through the LFUCG website. There was an informational session, and I said, well, I'm going to go to this session to find out if my organization, because Sisters Road to Freedom is faith-based, and so I was concerned about that, but I still made the decision to go to the informational meeting to find out how I can apply. And I attended, and Laura and Larry were just wonderful and encouraging to me, and they said, no, don't let that hamper you from applying. Applied. I took a lot of detailed notes, and I went home and I started on the application process, and I submitted it well before the deadline date. Next thing I knew, I got a call saying, your program looks wonderful. We want you to come in to interview before the Partners for Youth board for this grant. And so I went for the interview before a panel, several people asking questions from left, center, right, all around. But I was able to answer passionately because, I'm very passionate about this organization and what we're about to do, for these teen girls and their moms. And so, I was given a grant from Partners for Youth, for which I'm very, very grateful.
I encourage them to attend this program because it will help them. It'll help them become closer to their mom, and it will help them make better decisions so that they have a better future.